Hello everyone, welcome back to my channel Oral Health Management by Dr. Alka Khade. Today's talk is on sleep apnea. Sleep apnea is potentially a sleep disorder in which the patient's breathing repeatedly stops and starts. If you feel tired even after a whole night sleeps, then you might have a sleep apnea. Now we'll see the types of sleep apnea. There are three main types of sleep apnea. The number one is obstructive sleep apnea disorder. It occurs when throat totally relaxed. Number two is the central sleep apnea disorder. When brain stops sending signals to the muscle that controls breathing. And number third, the last one is the complex sleep apnea disorder. It is also known as the treatment emergent central sleep apnea disorder. It is seen in someone who has obstructive sleep apnea and central sleep apnea both. If you think you might have sleep apnea, see your doctor. Treatment can ease your symptoms and might help prevent heart problems and other complications. Now we'll see the symptoms. The sign and symptoms of obstructive and central sleep apnea overlaps, sometimes making it difficult to determine which type you have. The most common sign and symptoms of obstructive and central sleep apnea includes loud snoring, episodes in which you stop breathing during sleep, which would be reported by another person, gasping for air during sleep, awakening with a dry mouth, morning headache, difficulty staying asleep, that is the insomnia, excessive daytime sleepiness, difficulty paying attention while awake, and the last one is irritability. Now we'll talk about the central sleep apnea. This less common form of sleep apnea occurs when your brain fails to transmit signals to your breathing muscles. This means that you make no effort to breathe for a short period. You might awaken with shortness of breath or have a difficulty time getting to sleep or staying asleep. Now the main risk factors for sleep apnea can affect anyone, even the children's, but certain factors that increases your risk. The factors that increases the risk of obstructive sleep apnea we'll see. Number one is excessive weight. Number two is neck circumference. Number three is narrowed airway. Number four is being male. Number five is being older. Number six is family history. And number 7 is use of alcohol, sedatives or tranquilizers. Number 8 is smoking. Number 9 is nasal congestion. And number 10 is medical condition. Now we'll see the complications of sleep apnea. Sleep apnea is a serious medical condition and the complication can occur is number 1 is daytime fatigue. Number 2 is high blood pressure or heart problems. Number 3 is diabetes type 2. And number 4 is metabolic syndromes. These disorders which includes high blood pressure, abnormal cholesterol level, high blood sugar and an increased waist circumference is linked to a higher risk of heart diseases. Number 5 is complications with medication and surgery. Number 6 is liver problems and number 7 is sleep deprived partners. Now we'll see the diagnosis. How will you diagnose the sleep apnea? Your doctor may make an evaluation based on your sign and symptoms and a sleep history which you can provide with help from someone who shares your bed or your household if possible. You are likely to be referred to a sleep disorder center. There a sleep specialist can help you determine your need for further evaluation. Now we'll see the treatment part. For milder cases of sleep apnea, your doctor may recommend only lifestyle changes such as losing weight or quitting smoking. Your doctor will recommend treatment for your allergies. If these measures don't improve your sign and symptoms or if your apnea is moderate to severe, a number of other treatments are available. Certain devices can help open up a blocked airway. In other cases, surgery might be necessary. The most common therapies that includes continuous positive airway pressure, that is a CPAP. If you have moderate to severe sleep apnea, you might benefit from using a machine that delivers air pressure through a mask while you sleep. With CPAP, the air pressure is somewhat greater than that of the surrounding air and is just enough to keep your upper airway passages open, preventing sleep and snoring. The other treatment that includes oral appliances. The another option is wearing an oral appliances designed to keep your throat open. CPAP is more reliably effective than oral appliances, but oral appliances might be easier to use. Some are designed to open your throat by bringing your jaw forward, which can sometimes relieve snoring and mild obstructive sleep apnea. Number of devices are available from your dentist. You might need to try different devices before finding one that works for you. The last option is surgery. Surgery is usually only an option after other treatments have failed. Generally, at least a 3 months trial of other treatment options is suggested before considering surgery. However, for a small number of people with certain jaw structure problems, it's good first option that includes tissue removal, tissue shrinkage, and number 3 is jaw repositioning. Number 4 is implant. Number 5 is nerve stimulation. And number 6 is creating a new air passageway. The other types of surgery may help reduce snoring and contribute to the treatment of sleep apnea by clearing or enlarging air passage. Number 1, surgery to remove enlarged tonsils or adenoids, and number 2 is weight loss or bariatric surgery. The lifestyle and the home remedies are also included. In some cases, self-care might be a way for you to deal with obstructive sleep apnea and possibly central sleep apnea. That includes number 1, lose excessive weight. Number 2, do regular exercises. Number 3, avoid alcohol or certain medication such as tranquilizer or sleeping pills. Number 4 is sleep on your side or abdomen rather than on your back. And the last one is don't smoke. Our famous Indian singer Bappi Lahiri was recently died because of sleep apnea. So friends, do visit to your dentist because he is the right person. He will guide you correctly if you have a sign of sleep apnea. See you soon with the next video. Till then, bye bye. Thanks.